Hello and welcome to a brand new episode of Health360. The last few days or so, there's been just so much chatter around HMPV, the human metapneumovirus. Now, in ordinary times and circumstances, a couple of infections being reported from China, a viral infection would obviously not cause any concern or any stir. But post-2019, given the situation in China, in Wuhan particularly, when the COVID-19 pandemic began, things have been far from normal. The pandemic continues, and the mention of the word virus sends a chill down our spines. The WHO has warned that disease X will cause a pandemic, and the next pandemic is around the corner. Imagine then what videos of overcrowded hospitals in China would do to all of us. Our reactions were predictable. But here at India Today, we've been getting you facts on HMPV, and Health360 Today will be doing the same. I'm Sneha Mordani.
Big breaking news.
Human metapneumovirus.
Is this virus dangerous?
HMPV alarm in India.
HMPV alarm in India.
Statement that's come in from Union Health Minister Mr. JP Nadda, who's the bad news.
2 cases of the human metapneumovirus.
Some initial cases have represented here in India as well.
Another scare from China with regard to the HMPV
The HMPV virus has raised alarm almost across the country.
The week gone by has introduced us to another virus which has been around for 66 years and was first identified in the year 2001, HMPV. Let's tell you about the situation in India and how news of a virus spread in China played out. It started with these videos, not from the COVID-19 pandemic, but from the recent outbreak of HMPV cases in China. A situation that China says is a winter occurrence. The last few days has seen a big concern over cases of the human metapneumovirus, a viral infection that is not like novel coronavirus. The fact that it had been around for years was not consolation enough though. The Indian government has stepped in, making assurances.
चीन में जो HMPV वायरस के मामले पर हाल ही में आई रिपोर्ट्स पर स्वास्थ्य मंत्रालय ने इंडियन काउंसिल फॉर मेडिकल रिसर्च के साथ और नेशनल सेंटर फॉर डिजीज कंट्रोल के साथ, वर्ल्ड हेल्थ ऑर्गेनाइजेशन के साथ चीन सहित पड़ोसी देशों में स्थिति पर कड़ी निगरानी रखी हुई और भारत में किसी भी कॉमन रेस्पिरेटरी वायरल पैथोजन में किसी भी प्रकार की वृद्धि नहीं देखी गई। जॉइंट मॉनिटरिंग ग्रुप की बैठक 4 जनवरी को आयोजित की गई थी और स्थिति का जायजा लिया गया है। देश के हेल्थ सिस्टम्स और सर्विलेंस नेटवर्क्स किसी भी उभरते हुए हेल्थ चैलेंज के प्रति क्विक रिस्पांस देने के लिए सक्षम है और तैयार है।
Questions have been raised on whether China again is brushing things under the carpet, a valid concern perhaps.
HMPV is human metapneumovirus, which is a respiratory virus, and there are 2 types of viruses, DNA virus and mRNA virus, and it's one of an RNA virus, and which is actually of family Pneumoviridae. And another respiratory virus called respiratory syncytial virus is also of same family. Apart from these viruses, then influenza, adenovirus, coronavirus, these are some respiratory system virus which affects your nose, the windpipe and the lungs.
As India remains on the edge with over 8 cases, mostly children, including a patient from Ahmedabad, an 80-year-old, the government says they are watchful and in control. The World Health Organization has said that increase in these infections is expected in winters and that China has a sentinel surveillance system for influenza-like viruses, adding that these pathogens are known ones.
China's reported levels of respiratory infections are within the normal range. It's what we expect to see for the winter season. Authorities report that hospital utilization is currently actually lower than usual, is currently lower than this time last year, and there have been no emergency declarations. This is really important. There have been no emergency declarations.
Human metapneumovirus, a disease that the general population had not heard of, is suddenly the talk of the town. Everyone wants to know about HMPV and how it can affect them and their loved ones. Last few days have seen panic, fear and anxiety grip India. Well, as we mark 5 years of the beginning of the COVID-19 pandemic, the big question mark is on whether this virus, again seen in China, has the potential to wreak havoc, cause an epidemic or even a pandemic. According to the US Center for Disease Control and Prevention, this virus, first identified in the year 2001, has existed on Earth for 66 years. Experts suggest that going by serological studies and evidence, the virus has been circulating since the year 1958. The first case of HMPV was detected way back in the year 2001 by Dutch researchers examining samples of children with respiratory infections, according to the CDC. The presence of this respiratory illness has existed for close to 6 decades now. This pathogen has spread across the globe, mainly through droplets via people sneezing and coughing. The immune response induced by HMPV is considered weak to stop repeated instances of infections. Though it can be found throughout the year, it is most detected in winter and spring as per the CDC. HMPV is seasonal, typically prevalent during winter and early spring. Similarly to respiratory infections, China, currently experiencing winter, is witnessing a surge in metapneumovirus infections. All right, let's get you up to speed with the situation globally about HMPV. How does it look like? Cases, of course, seen in China. The actual numbers, though, are not known. The Chinese authorities are not giving that out, but the CDC statistics indicate that multiple flu-like infections are on the rise in China, led by influenza at 30.2% of positive respiratory illness tests, and HMPV is second in number at about 6.2%. What about the cases in our country, in India? Again, officially, cases are not being given out. The estimate is that at least 8 cases have been reported already. In Japan, then, influenza outbreak, of course, has been reported. Over 94,259 flu patients reported in the week leading up to the 15th of December 2024. This, of course, is through the Japan Broadcasting Corporation. In Hong Kong, accurate figures again not being given out, but the authorities are on high alert. Malaysia has seen 327 cases reported in 2024, which is a 45% increase from 2023. Straits Times is reporting on that. Cases in Kazakhstan stands at about 30 or so. Other countries like Vietnam and Indonesia are also on high alert, is what we know. All right, now comparisons between HMPV and the novel coronavirus that caused the COVID-19 pandemic is very natural given their timelines and given the country also from where it all started. Let's tell you a little about what happened 5 years ago in the month of December, to be specific, on the 31st of December 2019, where China reported outbreak of an infection to the World Health Organization, saying that pneumonia-like cases in China are increasing drastically. Late December 2024, reports emerge of respiratory infections again emerging and increasing in China. Well then, again, 31st of December was the time when the cluster of infections were reported. That pneumonia-like infections are increasing. It's a cluster outbreak, was what was said by China. Late December, infections coincide with the winter, is when infections increase in China, and this was being said to be a winter occurrence. China had said it. Later on, 7th of January 2020, when Chinese scientists ended up identifying the novel coronavirus as the reason, perhaps being the reason behind the increase in pneumonia-like infections in China. 1st of January 2025, the New Year day, where social media posts were full of lots of videos talking about overcrowded hospitals in China again. Then on the 20th of January 2020, the first confirmed case of the novel coronavirus was reported in the US. This was outside of China. 3rd of January 2025, where health officials confirmed that HMPV indeed is spreading rapidly in China and is the reason behind many respiratory infections. First confirmed case outside China, like I said, reported on the 20th of January. Symptoms similar to influenza and COVID-19 is what was said of HMPV on the 3rd of January. Then on the 30th of January 2020, 5 years ago, World Health Organization declared a public health emergency associated with the outbreak of these infections in China. On the 4th of January 2024, Chinese authorities ended up downplaying the situation, saying that HMPV is indeed just a winter occurrence, nothing to worry about. Again, it was described as an annual winter occurrence on the 4th of January by the Chinese health authorities. As far as coronavirus is concerned, remember the day of 11th of March 2020, when the World Health Organization declared COVID-19 as a global health pandemic, and it continues to be one. On the 4th of January again 2024, it was described by China as an annual winter occurrence. Kids are vulnerable is what experience has shown. Experts weigh in on why are kids more susceptible and how can we keep them safe.
Over 8 patients of HMPV in India detected in this cycle, all of them children. The human metapneumovirus affects infants, making them a vulnerable population, raising panic and anxiety among parents on how to keep them safe. So why are kids vulnerable?
And this is because the children in the smaller age group have a more immature immune system, so they can't fight off the infections that quickly. The breathing rate, that is the respiratory rate of children, is almost double as compared to adults. So they inhale more number of particles, more number of viruses potentially per minute. So children are always more susceptible, more vulnerable. But the first 1 year to 2 years is always a critical part to keep a child well, healthy and safe.
Children, infants below the age of 5, experts say have weaker immune systems. Infants and toddlers are especially vulnerable to serious respiratory conditions such as bronchiolitis and pneumonia. The best way to prevent HMPV, like any respiratory virus, is through simple hygiene practices.
So the main protection is not to expose the children, not to have a child which is thrown into a very large crowded area, not to have a child exposed to anyone who has fever, cold or cough or viral infections. Children remain best in an environmentally clean status. So hand washing of the mother is important, normal feeding, good nutrition, adequate hydration would keep the child well.
In children, HMPV can mimic the symptoms of other respiratory illnesses, such as a cold or the flu. The common signs include coughing, fever, runny nose, wheezing and difficulty in breathing, fatigue and decreased appetite. By recognizing the signs early and following proper care guidelines, you can help ensure a quicker recovery for your younger ones.
More about HMPV, breaking down the details for you. Let's tell you about the symptoms. The virus is known to cause illnesses ranging from mild respiratory discomfort to severe complications, especially in the vulnerable populations such as infants, older adults and individuals with weakened immune systems. Symptoms range from mild cold-like effects such as cough and fever to severe respiratory illnesses like pneumonia or bronchiolitis. It's prevalent globally and tends to peak during late winter and early spring in temperate regions, although it circulates year-round in some areas. How is HMPV detected? Diagnosing HMPV based solely on symptoms can be challenging. as it mimics other respiratory infections. RT-PCR is the gold standard diagnostic tool for detecting the presence of the virus in the body. Ministry of Health has said it is closely monitoring the situation through all available channels and also requested the World Health Organization to share timely updates regarding the situation. What about the treatment of HMPV? Currently, there is no specific antiviral medication or vaccines available for HMPV. Treatment is supportive and depends on the severity of the infection. For mild cases, rest, adequate hydration, and over-the-counter medications to manage fever and nasal congestion are sufficient. In severe cases, particularly those involving pneumonia or bronchiolitis, oxygen therapy and hospitalization may be required. Patients experiencing significant respiratory distress may need mechanical ventilation. While research is going on to develop targeted therapies and vaccines, preventive measures and early medical intervention remain key to managing HMPV infections. Is there a reason to worry? The world is still recovering from the horrors of coronavirus COVID-19. And while both HMPV and COVID are respiratory pathogens, they differ significantly in the virology, the transmission dynamics, and the health impact. As of now, there is no reason to worry.
Metapneumovirus is like any other respiratory virus which causes a common cold. And in the very old and the very young, it could cause flu-like symptoms. One thing I would like to convey to the public is to take the general precautions that we use against all respiratory infections, which means in case somebody has cough and cold, he should avoid coming in contact with a lot number of people so that the infection does not spread, and take the normal medicines that are required for cold or fever whenever it's there. Otherwise, nothing to be alarmed about the present situation.
Will antibiotics then work? Antibiotics are not effective against HMPV because it's caused by a virus, not bacteria. Popping antibiotics will not help you. Similarities between HMPV and COVID-19 then. Similarities include their modes of transmission. Both spread through respiratory droplets, direct contact, contaminated surfaces. Both can cause mild to severe respiratory symptoms such as cough, fever, shortness of breath. They are particularly dangerous for vulnerable populations, including for infants, older adults, and those with weakened immune systems. Let's tell you a little about the differences between HMPV and COVID-19. Well, loss of smell and taste was a common thing to be seen in patients suffering from COVID-19. No loss of smell and taste in patients suffering from HMPV. Vaccine was developed for the novel coronavirus COVID-19 within a year. There is no vaccine yet for HMPV. COVID-19 was unpredictable, caused due to a new virus, the novel coronavirus. HMPV, on the other hand, has been identified in the year 2001 in circulation since the year 1958. COVID-19 caused global havoc. HMPV has been around in many other countries, but has not caused any havoc, not just yet.
Children and especially infants and people above 60 years of age, so these people get serious problems. There is no antiviral or medications like which is there for other viruses like flu and other viruses, influenza, but there is no medical treatment for it. So your own body eliminates and cures this virus.
Well, that brings us to the end of this edition of Health360. We hope you enjoyed watching the show as much as we did, putting it together for you. You can find these reports around HMPV and also news around health, fitness and wellness up on our website, that's indiatoday.in, on India Today's social media platforms as well, which is X, that's Twitter, Instagram, Facebook, and of course YouTube. The hashtag is Health360 and Health360 Plus. Do not forget to like, subscribe and share. From the entire team of Health360, take very good care of yourself. Bye for now.